Hello, everybody. Welcome again to Tempest Psychology. And today's interview is with Joanna Duyvenvoorde, who is a practitioner of the Sinclair Method. And this method is something that's used in alcohol addiction and can be used in other addiction treatments. And it's not something that's really adopted at the NHS here in the UK, but it is a treatment that is available to people. And what we go through in this interview is what is alcohol use disorder, what are some of the myths of alcohol use disorder, how can the Sinclair method help treat it, what is behind the incredibly high success rate of the Sinclair method. That is something that I'm particularly struck by, is when the Sinclair method is used appropriately and properly, um, the success rate is phenomenal. And it kind of baffles me why it's not widely adopted here in the UK. This method, I guess, was made famous by Claudia Christian, who played Ivanova in Babylon 5. And I first heard about this method when I read her biography, Babylon Confidential. And then I looked into the method, I read the textbook on it. It's not a method that I use myself, mainly because it's not available on the NHS. And I would encourage anybody to watch this interview, find out more about the Sinclair method. Um, and I hope you get something out of this interview, and I hope it helps. Thank you.
I guess the best place to start is what actually is alcoholism, because a lot of people coming into this might have a very generic idea of what alcoholism is.
Sure.
And so for you, what are some of the main misconceptions that people have about alcoholism?
Firstly, the name. The word alcoholism itself has got such a stigma attached to it. So it's officially called alcohol use disorder now. Some people call it alcohol misuse. Others call it alcohol dependency, alcohol problems. I think the thing is a lot of what we go through these days is very, very stigmatized. And what we're trying to do is take the stigma out of it so that people can feel more comfortable asking for help.
Totally.
So in terms, I mean, drinking problems generally affects everybody. It's a spectrum. It goes from, mild dependency issues to moderate to severe. It includes binge drinking. I like to think of it as, if you think you're drinking too much, you probably are.
Yeah.
And if you're thinking about drinking when you're not drinking, then yeah, you've probably got something that needs to be looked at. So that's how I personally view that word and what what it actually means in reality. Is certainly, if there's a problem in somebody's life, then
yeah,
it needs sorting.
And it's certainly a much more compassionate way of thinking about it.
Which is something very much about the Sinclair method itself. It's such a humane treatment.
Yeah.
There's no shame attached to it. So, the first thing we have to do with nearly any problem today is take the stigma out of it.
Exactly.
I think it's something like 9 out of 10 people won't ask for help because they're afraid of how it might affect the job or the family, or so we've got to take the stigma out of it for sure, and the shame.
Yeah, and certainly with a lot of interviews I've done in the past for research projects have been about people with living with mental health difficulties, and a lot of their problems stem from the social stigma of the issue that they have and how they worry about it, and then that fuels their illness and makes it way worse than it should be.
Yeah, absolutely. And in a lot of cases now, you can't get help for your mental health situation unless you're abstinent. But then you can't, on the other hand, you can't get abstinent if you've got mental health issues.
Exactly.
Everything needs bringing together under a better umbrella, for sure.
Yeah.
Agreed.
And one of the things that really blew my mind, actually, when I was doing my psychology degree, was about how not all people with alcohol use disorder actually drink to excess. It's much more about self-medication.
In a lot of cases, yeah, there's people with bipolar, ADHD, or even if you're just self-medicating something like work stress.
Yeah.
If you begin to rely on it a little bit too much, and you begin to find that after a hard day at work, it's like your first thought is, gosh, I really need a drink. But then you're struggling to stop after that.
Yeah.
And yeah, absolutely.
And even with sleep problems, some people drink to go to bed at night. Otherwise, I mean, I know it's quite rare, but yeah, some people even do that.
Yeah, actually, it's probably not as rare as what you think.
Oh, really?
A lot of people, yeah, and very much when people sort of go through the traditional route of having to just stop drinking, it's sleep issues are huge.
Yeah.
But basically the nervous system it's missing something, so your nervous system goes into panic mode if you're not drinking, and so
Wow.
it can take a long while for sleep issues to calm down, for sure.
And that's even without the extreme response from your body of delirium tremens. Even if it's not that extreme, your nervous system is still reacting and still going to make you sick.
Yeah, and even small amounts over a long period of time, the body will get used to it and adjust to it. And then if you remove that suddenly, yes, it's not going to necessarily put them at a medical risk of alcohol withdrawals, but minor things, agitation, anxiety, sleep issues, they can all come to the head. Yeah.
And how much of a role, or what have you, does lapses and relapses play with an alcohol use disorder?
Do you mean with regards to more traditional treatment?
Yeah, I guess so. Yeah.
More traditional treatment. There are some statistics that have come out from, I think it's from America, where something like 90% of people will relapse within 4 years.
Okay. Wow.
The statistics are very, very high, and you can look at this two ways. If there is a reason somebody is drinking, if that reason isn't worked on, then the reason remains, and all you've done is you've removed the comfort blanket, if you like.
Yeah.
So relapse you can do really well for a week or two, and then all of a sudden something will come that maybe you couldn't practice for, and you relapse. Also, people going through therapy, it's incredibly difficult to do therapy and deal with all the emotional things that brings up without having your comfort blanket there.
Yeah.
And that's another good thing about the Sinclair method. It's saying, we don't want you to be drinking the same amount. We want to be working towards better behaviors. But on the other hand, at least you're not trying to manage things and deal with things in your life without your comfort blanket there. Relapse is a really major problem, not just for the drinker, but for families, for workplaces. It affects everything. Nobody's firing on all cylinders if they're struggling.
Yeah, exactly. It's like trying to do something with an open wound, isn't it? Or the flesh is still raw,
Absolutely.
Trying to play sport with a bad knee or something,
Yeah, and to be honest, a lot of drinkers are scared of it. If you remove this, what am I going to do?
Yeah.
So even before they've tried to stop drinking, they've already got a mindset that they're very afraid of stopping drinking.
Yeah.
So it's relapse is high in traditional treatment. That's really all you can say, because it is.
Yeah. It's just one of the most factual facts that there is.
Yeah, absolutely. Yeah, absolutely.
So before we go into the specifics of what the Sinclair method is, what actually brings people to your service, and what sort of stage of recovery are they at?
Okay. Usually the internet initially. There's a fantastic TEDx talk that Claudia Christie, the actress, did. That's probably one of the main ways that people will find us. Whatever algorithms that YouTube uses, if somebody's doing searching for drinking problems, that will sooner or later that will pop up. And it's a very short 15-minute video that is very impactful. So the internet, thankfully, also thanks to the pandemic, lots of people have had lots of time to Google, and then thank you to algorithms, these things are popping up, which is great. Very, very few people find us without having tried other things. The majority of people who find us have already tried more traditional treatments, such as peer support groups, such as AA. They may have tried a couple of other medications in the past, because there are several medications approved for it. They may have just tried to cut down on their own. Very few people come to us and sort of say, right, you're the first thing I'm trying, which is quite sad, because when you look at the success rate of the Sinclair method, it probably should be the go-to treatment.
I actually did. On the success rate, I was quite surprised at how successful it actually is. I was reading some of the book. Very, very high. And
it is.
The circumstances in which it's successful, because a lot of the naltrexone studies don't actually follow the Sinclair method, so it makes it look like naltrexone's got a low efficacy. But then and then when they find that actually, if you look at the population that was successful, what was successful about it, and it was the people who were relapsing and still using the naltrexone, and then they were actually the ones that were getting better, which the study discounted.
This is the thing that it depends what the goals are of the study. I mean,
Mm.
this is the thing. Most studies can be made to reflect, depending on how you interpret
Exactly.
the results.
Mm.
Having said that, you can't get away from the facts that using an opioid blocker such as naltrexone, such as nalmefene, which is the medication that's officially approved across Europe to be taken while drinking, you can't get away from the fact that when people take these medications and they do additional things on their behavior, their drinking will generally reduce. There's very few people it doesn't work for.
Yeah, it's incredible. So I guess that's a quite good segue then into what actually is the Sinclair method. What does it involve?
Okay, think of Pavlov's dog. Doing psychology, you've probably come across that.
Yes.
The concept that the dog's, a bell would be rung and then food would be given, and the dog's brain associated that bell with food. So therefore, when they heard the bell, they already began to salivate.
Yeah.
Because they knew they were going to be given food. So the Sinclair method is kind of that in reverse. It takes the science of saying, look, your brain has learned this behavior. If we short circuit that mechanism, surely it will unlearn the behavior.
Yeah.
And that's exactly what happened in Pavlov's dog.
Yeah.
When the bell was rung and the food wasn't given, eventually the dogs learned the food wasn't going to be given and they stopped salivating.
Yeah.
So what the Sinclair method does is it uses this element of science of the learning mechanism in the brain, and it basically short circuits it. It takes either naltrexone or nalmefene an hour or 2 hours before the first drink.
Okay.
And that reinforcement process that has been going on, that says alcohol equals reward, that gets short circuited. So over time, you're repeating the behavior in the sense of you're drinking still, but you're not drinking the same amounts. You know, I mean, everybody associated with the Sinclair method will be working on better practices in terms of helping somebody reduce drinking.
Okay.
And then in a nutshell, all it does is it stops that reinforcement happening so that the brain begins to realize that alcohol isn't as important as it used to be.
Yeah.
It falls away. So instead of alcohol being the all-important factor in somebody's head, it moves to the back. So almost like it's, instead of having it in the front pocket, it's gone to the back pocket, and it's just not so important anymore. And then you replace that with other behaviors that do give the brain a chemical reward.
Yeah.
And like a pendulum, it begins to swing towards wanting the other behaviors.
Yeah, that's interesting. And then, because I guess it's the dopamine release of having the alcohol and the euphoria associated with it.
Yeah.
And
it's actually the endorphin release that hits the opioid receptors and creates the dopamine. So if you cover the opioid receptors, the endorphins that are released literally just bounce off. So it can't create that it can't create that chemical process.
Yeah. Interesting. And then so you I guess you're kind of picking the battles that you have to fight. So you're not having to work on the actual physical behavior itself. So if we were doing cognitive behavioral therapy, we might be looking at when I'm drinking and what I'm trying to do to stop it. But then you're not actually tackling, the things with the endorphins being released. But then so you're flipping it around so that, okay, we'll tackle the endorphins because that's interrupting the reward system in your brain chemistry. And the behavior in time will readjust because you're not getting that reward.
Yes, it will. But what we try to do at Sinclair Method UK is do the best of both worlds. Let's break the reinforcement with the tablet, but then also let's work on the behavior behind the scenes.
Oh, cool.
It's a fantastic pill. It really is. It works. It's science, but it's not a magic pill. You do. If you was to go to the shop every day and buy a bottle of wine, the tablet isn't going to physically stop you doing that.
Yes.
It takes the reward away from it, but the act of actually going to the shop and buying the bottle of wine, that needs to be worked on. So we do the best of both worlds. In theory, absolutely, if you just took the pill and you stuck to the protocol, the science would work. Your need to drink would fall away, and then you would probably stop going to the shop.
And I guess where you've got a more holistic approach, you're actually working on the root causes of why the behavior evolved in the first place in that person.
Yes, usually. And also from a family perspective, that's very important as well, because as a family, it takes a lot for a family member to actually go, okay, we're going to do this, because that family member wants that person to stop drinking.
Yeah.
And so the worst thing really you could do is say, okay, just take a tablet before you drink it, but carry on.
Oh yeah.
You know, in order for everything to merge together and to get, it's not that you're going to get better results, you're just going to get a smoother process.
Okay.
You know, if the science is going to work, the science is going to work, end of story. But from a family perspective, job perspective, health perspective, working on helping that person to immediately begin to reduce the drinking alongside the pill, definitely the best way to go.
And what sort of interventions do you have in that regard with working on behavior?
Yep, first month is probably based around just making sure the protocol is working correctly, the person's taking the pill.
Okay.
Let it bed in a little bit, you know, get a little bit of confidence for that person.
Okay.
Then we begin to work on, if we need to, we're CBT qualified, so if we need to, we will do that.
Okay.
In a lot of cases, it's really just behavioral changing techniques.
Yeah.
You know, the realization that what is a false belief, what is a real belief. A false belief being perhaps that person needs a full bottle of wine.
Yeah.
Well, they actually don't, but that's how they've convinced themselves.
Yeah.
Or the false belief that they must have so much in the house because what happens if they run out? You know, that type of thing.
Yeah.
So very much geared around, the initial bit is very much geared around the protocol of the treatment itself. The second half is more around behavioral changes, working in conjunction with the pill, learning to do behaviors when you're not drinking so that you can benefit from the endorphins that those behaviors release. And all of that, like you say, it's very holistic.
Yeah.
It's everything. It's not just about putting the drink down.
And again, it's just what strikes me is the compassion, again, that word, the compassion behind the Sinclair method, that you are looking, you're that the method is the one port of call that this person is using, and it's just it's taken into account all their life, and you know, it's working for the betterment of everybody involved that's affected by
Absolutely
the illness.
Yeah, I mean, illustrated by a lot of people who write to us after maybe 9 months and say, you know what, I'm taking the family for my first holiday.
Oh,
obviously pre-pandemic.
Yeah,
but that used to happen a lot, and it used to be, wow, 9 months ago, 9 months ago, that family was on the cusp of divorce, of separation, of losing the job, of maybe losing the home, and now they're writing to us. And there was one lovely chap I spoke to. He bought his first ever motorbike. He really, all his life, he wanted this big, powerful motorbike.
Yeah.
And I posted some photos actually on our social media, because he could never buy the motorbike because he could never stay abstinent. And he was worried about drink driving.
Oh, okay.
And now he took it all the way. He took the Sinclair method can be used to control your drinking, reduce your drinking, or taken to the nth degree, it takes you right down to a comfortable abstinence.
Yeah. That's
so
incredible.
This particular chap had been abstinent for a while. He'd been saving lots of money because he wasn't drinking. And out of the blue, a few months later, he sends me a picture of this brand new motorbike that he bought.
Oh, wow. That's...
You know, it's the joy is just fantastic.
And how long does it take a typical person to kind of get through the Sinclair method and see that level of success?
Yeah, very individual. A lot of it is based on how strong the pathway is in the brain.
Okay.
Which is in terms of, you know, how long has it been reinforced? How long have they had a drinking issue? People who, for example, during the pandemic, we're beginning to see people who have stepped over that edge. We're finding they're coming back a lot quicker because the pathway in their brain isn't quite as reinforced as somebody who was drinking 20 years.
Yeah.
On average for us at the moment, I would say probably 6 to 8 months.
Okay.
Is not a bad gauge.
Yeah.
As a general rule, the more work you're doing to help the tablet along and changing your behavior, the sooner you're going to start seeing significant results.
Okay. So yeah, that's going to be my next question, is what are the best indicators that someone's going to succeed using the Sinclair method? And I guess support circles, commitment.
Absolutely.
Strategies.
And probably the main one is that it's their choice.
Yeah.
The people we find who really struggle with the Sinclair method, quite honestly, people has been a little bit cajoled into it. You know, the family may be on the cusp of divorce, and the drinker may see this as being, oh, this is another way to sort of delay things a bit. I will get this sorted, but and so it's a little bit a last chance saloon for some people. And if that's coming from the partner in a relationship, usually the drinker is the one that will have struggles with the Sinclair method. It's difficult, like any treatment of any condition, you know, be it binge eating or you know, wanting to lose weight, anything like that. There is an element of having to want to change enough that you will take the tablet. Compliance isn't an issue for us as long as somebody chooses themselves to do it, for sure.
And it's I guess it comes down to doing it for yourself and your self benefit. Like, it can't just be coerced by other people, even though that is always going to be part of it, but that on its own isn't going to keep you committed to any form of therapy.
And exactly, something that can take 6 to 8 months, you know. If we will often mention this, because what we don't want is people doing the treatment if they're absolutely not going to be committed to it, because in the long run it can actually make drinking worse. So we don't want that. So we need to try and do is we do quite a thorough screening process first, then the person goes away, and then we do a second a doctor does a second medical consultation. So it gives enough opportunity for that person to really consider and go, because there's always a treatment out there for somebody. That's the key. Just the Sinclair method is currently, that I'm aware of, the most successful. But for people who can't do the Sinclair method, or maybe they're taking a medication, that means that it's going to counteract badly. You know, there's other options out there. So it's, rather than force somebody into a particular route, it's always best to get the whole picture from them, so that we can fit the treatment accordingly.
And when somebody's either completed the Sinclair method protocol or they move on to something else, is there any sort of aftercare that's provided, or is it needed or even appropriate?
We do if they need it, but generally the only aftercare is the fact that they know they're better taking the tablet. So if they do want to continue drinking, if you consider the brain has learned to process, the tablet has pharmacologically reversed that process. If that person then drinks again without the protection of the tablet, they're going to relearn it again. So if they continue to carry on drinking, then they do need to carry on taking a pill before doing so. A lot of people in the beginning will go, oh my God, that's terrible. But you know what, when life is so much better, the fact that if you want to drink every weekend, you might have to take a pill every weekend, it's nothing. By the time people reach that stage, they're thankful, because they know life is so much better than what it was. Taking a pill it's no big deal. It really isn't. It does seem it at the beginning, but when you get there, it really isn't.
And what is it like for people who do take the pill and then have a drink? Because it's hard for me to kind of comprehend how that would feel in my mind, not to have that buzz from the alcohol and that sort of thing.
But buzz is a strange word. It's the tablet doesn't interact with the alcohol at all. So if you have a drink, you'll still taste it. If you have a few drinks, you'll get tipsy and relaxed. If you overdrink, you'll get drunk. It's no interaction at all. The bit that is removed from it is the more sensation. So normally the person has that first drink, and then it's like all bets are off, because that first drink fired everything up in the brain. And now the brain needs to maintain it. So it's get that one down, get on to the next one. That is the bit that's removed. So for the majority of people, very, very quickly they'll find the drinking a lot slower. Just because that more isn't there anymore. They're learning that actually alcohol's, if they want to drink, alcohol's fine. But it helps them to be able to recognize when they've had enough.
And that is probably the biggest part of it for anything in life, where if you've got an impulse issue with a certain stimulus, and just that, wanting more of that one thing, even if it's chocolate or a TV program, we don't make very healthy choices sometimes.
We don't. We're not robots. We're humans.
Exactly.
But there's lots and lots of tips people can also use in alongside the pill. So when they're going out, let's say somebody's out in a pub and after the lockdown and they've been social and they're loving being out again. We don't want them to concentrate on the Sinclair method. We want them to take the pill, enjoy themselves. And there's lots and lots of tips people can use to make sure they don't overdrink accidentally. A really good one being to set an alarm on the phone, a little vibrating alarm for every 2 hours, so that they can relax, they can enjoy themselves. But every 2 hours, a little reminder will go off in the pocket that enables them to take one step back and say, am I okay? Am I drinking too quick? Do I need food? Do I need water? So instead of having to concentrate all the time on the Sinclair method, once they get into it, it's just a case of checking in with themselves every so often.
I quite like that idea, actually, because it's encouraging a state of mindfulness as well.
Oh gosh, yes.
Without being obsessed, because sometimes with mindfulness I can get a bit obsessed with whatever it is I have to think about. But that's quite a nice way of, again, using the conditioning response in humans.
Exactly. And it's kind of strange, there's an awful lot that usually the things we were told when we were kids work best. You know, don't drink on an empty stomach. You know, don't drink too quick. And all of these things are useful, but they can be used alongside the Sinclair method. But initially, we don't want people to be sat there at a restaurant thinking, am I okay? You know, we want them to enjoy it. And because that is, if you want to use the term normal drinking, that would be normal drinking. The difference would be if let's say you're sat in a meal having a restaurant, somebody with a drink issue will generally drink so fast that their glass is empty and they're thinking, oh, everybody else is. They're not drinking fast enough. What the Sinclair method does is it removes that obsession so that they're drinking at the same speed as everybody else. Or in some cases, in a lot of cases, slower, actually.
That's something I find interesting as well, because in British culture, we do tend to drink quite quickly, apparently. This is what I've been told by some of my European friends. I was in Greece once and it was really hot. So I just drank this drink, it was vodka and a mixer, and I drank it really quick because I was so thirsty, and then everybody just stared at me as if I'd like done something really bad. And then that was the first time I'd really thought about that whoa, what is British culture like, and how much does it encourage that drinking behavior?
Well, funnily enough, one of the medications that can be used for this, it's called nalmefene. It was approved in 2014. The British press called it the anti-binge drinking pill. And it isn't really, it's not, I mean, it was marketed so badly. You know, it doesn't stop people binging. You know, you could, with the best will in the world, if you take a pill and then drink 6 double vodkas in an hour, you know, you're binging.
Exactly.
But what it does do is it gives you the opportunity to slow down, to use these best behaviors. So the fact that it was marketed as an anti-binge pill probably tells you an awful lot about our press, our culture.
And I think that's definitely contributed a lot to how people perceive alcohol use disorder and how they perceive the drinking culture in Britain.
Agreed.
So actually talk about nalmefene and naltrexone. I know they do try and use it in NHS alcohol recovery services, but obviously the Sinclair method uses it very differently. And what do you think is the difference between why the Sinclair method is so successful compared to regular NHS alcohol recovery services?
Right. The Sinclair method using nalmefene, which is the medication that was officially approved to be taken prior to drinking, that was officially approved for GPs to prescribe. However, it can only be prescribed alongside this additional support treatment plan that we spoke about. So as a result, GPs don't have the training, they don't have the budget, they don't have the staff to provide that. So as far as nalmefene goes, everything was kicked over to where the existing services are. And nalmefene was approved for people with mild to moderate issues with alcohol. The problem then became that the alcohol and drug recovery services, as a general rule, they weren't seeing people with mild to moderate problems. They were seeing people with quite severe problems. So people were going into the alcohol recovery centres and they were being, we don't know anything about this. Go to your GP. Your GP was going, go to your alcohol recovery. So there was actually a whole report done by the NHS about how all of the bureaucracy got in the way, and there's too many people involved. It didn't filter down.
Yeah.
So in theory, you should be able to walk into your alcohol recovery centre and say, I've got an issue. I would like to be prescribed nalmefene to help me reduce. In a lot of cases, they just don't know what it is, and you have to educate them. And we have numerous times of it either being prescribed with abstinence, which it shouldn't be, just education, really. So that's the nalmefene side of things. The naltrexone side of things is basically because it was approved to be taken when somebody has been detoxed to help them not relapse back to drinking.
Okay.
As we know, it doesn't work that well. So it's got a bad rap amongst doctors. There's another medication called acamprosate, which is also prescribed to prevent a relapse. That works a lot better than naltrexone does. So therefore, most doctors in alcohol drug recovery centres, they won't prescribe naltrexone because they've seen it not work.
Yeah.
You know, they've got a choice of 2 medications to prevent relapse. Understandably, they're going to prescribe the one that actually does work better in that case. And then if you take the NHS as a whole, as wonderful as it is, it's always so many years behind.
Totally.
There's nobody knocking on the NHS's door to try and change their prescribing instructions for naltrexone.
Yeah.
And that's where the bulk of the gulf, the gap between what they're doing and the Sinclair method exists. Somebody will mention the Sinclair method, they think somebody's seen something on the internet. You know, I've had doctors tell patients the medication's still in clinical testing.
Yes, no.
What? You know, it's unfortunate. A lot of doctors are quite well educated about this. The problem with the alcohol recovery centres is you don't get to see a doctor immediately.
Yeah.
You have to have an assessment, then you're appointed a key worker, then you have to have, in most cases, the majority of the group talk therapy.
Yeah.
And it can be literally weeks and weeks and months before you're actually allowed to sit in front of a doctor there. Which is a shame, but you can't change that. There's so many different providers across the country. They've all got their own rules.
Yeah. I think with the NHS again, I'm somebody that I'm very supportive of the NHS, but I think that the Sinclair method is the perfect example of the issues with the NHS that we have.
Yeah,
I think it just everything is just in such stark contrast with this method because it's so successful yet not widely adopted. And it's because of the way that the NHS is set up. It's not very flexible. It's resistant to change.
That's it. I mean, we've tried all sorts. I've tried to get MPs involved. I put questions to Parliament, and it's just like hitting your head against a brick wall. This is what it is, and the majority of people engaged in alcohol recovery services, they're being led by people who don't even know this exists.
Yeah.
They don't, in a lot of cases, they don't even know nalmefene exists, let alone naltrexone.
Yeah.
And how can you have a medication that's been approved for 8 years now?
Yeah.
And the people working in that industry don't know about it.
Yeah.
I mean, imagine you working in your industry. You want to keep track of everything that's going on around you.
Yeah, exactly. And the way that I found out about it was because I was I think it's just so typical of the people that find out about Sinclair Method. I was rewatching Babylon 5, and then I just randomly ended up finding about Claudia Christian did a biography about her experiences.
Yeah.
And then I read that biography and I was like, oh my God, this sounds amazing. And then I got in contact with her just to say, about this interview. And then she sent me the book about the Sinclair Method. So, I read most of that. And the whole thing blew me away. And then that's how I'm here talking to you now.
Yeah.
But it's the NHS that should be telling me about this.
Exactly. You should be able to go to your doctor. And I mean, and a lot of doctors, because they're not trained in it, a lot of GPs, they're just, it's not their fault, really. The general GPs, they're not trained in these type of things. Their guidelines say you just automatically refer somebody. And so, in a way, there's no blame. There's no blame on individual doctors as to why they don't know about it. However, when you get as far as the alcohol recovery services, you would expect them to know about it.
Yes.
Or at least heard of it,
Yeah, exactly.
It's almost amazing. I mean, they must be living under a rock to not know that, because especially now, because so many people are doing this now and so many people are searching the internet, so many people are writing about it.
Yeah.
without a doubt, Claudia's Babylon Confidential book, the
Yeah.
first one, that is how the majority of people prior to the internet found it.
Yeah.
Then she did a brilliant documentary called One Little Pill, which is absolutely awesome. It's 50 minutes long, so it's quite easy for family to watch as well, so they can understand it.
Okay.
But again, it was getting the word out there.
Yeah.
Now, thank you to YouTube and the TEDx talk that people are finding the 15-minute version first.
Yeah.
Then finding the One Little Pill documentary, and then finding the books. So it's kind of reversed itself.
Yeah.
But so many people are finding it now, and they're going to the doctors, they're talking to people at alcohol recovery centres, and unfortunately they're just being brushed off.
Yeah.
We don't prescribe medications, we don't do this, we don't do that.
Yeah. Yeah.
There is talk. I mean, I can't go into a lot of detail, but we are hoping the NHS Right to Choose will kick in at some point, hopefully during this year.
Good.
So that it is available on the NHS, but it will still be relatively difficult to get it, because you've got to go to your GP and you've got to say, I want to do this treatment, and this is the only place in the country that's providing it. And under the Right to Choose, you will be referred to that organisation.
Yeah.
But you've still got to then educate people how to approach the doctor.
Yes.
What is the Right to Choose system?
Exactly.
So that's where our work will be going later.
Oh, that's going to be a good focus, a very useful one, I think, because not everybody's relationship with their GP is deep or meaningful or supportive. Because most GPs are brilliant, but it's about marrying up a patient with a GP that suits them.
Exactly. And in a lot of cases, you don't get any choice, do you? And bless them, they're all under so much pressure because of the pandemic and everything. Yeah. We're very lucky now. We work with 4 prescribers who now understand the Sinclair Method.
Good.
So that's fantastic, because when one of them goes on holiday, we've got another option.
Yeah.
So it's all just about getting the word about the Sinclair Method out there.
Yeah.
But there are so many restrictions because we can't advertise. We can't use Google to advertise because there's some rules that Google have got in place to do with firstly to do with they don't advertise rehab centres, and even though we're classed as a rehab, we come under that heading.
Okay.
Then because we are counsellors and not doctors, we can't use Google ads because our website mentions the word medications. Actually, there's so many restrictions. So what we did was we said, well, we're going to have an advertising budget. And what we're going to do is we're going to put that budget into sponsoring organisations. So for the last year and this year, we're sponsoring UK Charity Week, which is a big thing every year in December. And that is helping to get the word out about the Sinclair Method.
Oh, cool.
So it's the same money we would have used had we been able to advertise.
So
it makes sense, and it helps not-for-profits as well. To raise their profile. Well, it's all finding a way around these very complicated systems.
Yeah, I feel like it's almost deliberately complicated, and I think that
that's being British, isn't it?
Yeah, that's true. Yeah, it's bureaucracy. And what I find personally troubling is that is the hypocrisy in what is allowed to be advertised and what isn't. And I'm not picking on any industry in particular or anything, but it's just, okay, so if you can't advertise, how could some of these other corporations do their advertising?
Yeah, it's amazing, isn't it?
Yeah, particularly when you've got science on your side, you've got experience, anecdotal evidence, clinical trials.
Yeah.
This is all out there. This is a very well supported method. It's just not adopted by the NHS at the moment.
Yeah, I think in a lot of cases, money and status talks.
Yeah.
Sinclair Method UK is a small family-run company based in Lincolnshire. It's not like, and not to down them at all because they're fantastic, but we haven't got the clout of the Amy Winehouse Foundation.
Yeah.
And I mean, and a lot of these organisations, these local alcohol recovery service, when you look at those, each of those contracts are worth like 20-30 million pounds.
Whoa.
We just don't have that clout, so we're like the little voice.
Yeah, just squeaking in the corner. Yeah.
But thankfully now, I mean, most of our, if you want to call it work, most of our work is done by word of mouth.
Yeah, yeah.
You know, people who's done this treatment over the last 6, 7, 8 years, now talking to other people, and everybody knows somebody who's got a problem usually with drink. It may not be too severe, but a lot of people are stretching over.
Yeah, yeah. I've known plenty of people in life just that they clearly have an issue with drinking, but it wouldn't be the, I guess, the pop culture stereotypical definition of it.
Yeah.
So people think it's not a problem, or that it's not becoming one, and
I mean, all sorts of people we're doing at the moment. We're helping with it. You know, people ranging from school teachers, housewives, house mums,
you
know, house dads, cabin crew, with pilots. You know, so many people who need the privacy aspect as well.
Yeah.
I mean, we've had a counsellor, as in a government counsellor, who couldn't go to the local alcohol recovery service. We've had a judge who couldn't go there because the judge had sent several people to get help.
Yeah.
Through drink and alcohol. So, you know, a week before, that person was maybe stood in front of that judge, being told they've got to go get help, and then it's not a politically correct thing to say, but that judge can't then go walk into the same service.
Yeah. It'd be very hard for them, because particularly where there's supposed to be a sense of anonymity about some of these services, and you know, it's the whole conflict of interest and ethics and things, and also it's the stigma attached to it that somebody's going to jump on that, aren't they? You just know.
Yeah, absolutely. And it's so sad, because if we could get through to judges as well, in the sense of when they see people who's maybe on the 6th, 7th drunken offence, you know, let's get that person the help they need, not just if you go here you'll stay out of prison. Let's try and get them some real help.
Yeah, that if you go here, you wouldn't just stay out of prison, your life will be better.
Yeah,
you know, it'll improve.
Yeah, but
and I guess this is one of my last questions, actually, this leads into is, with the pandemic's been rough for pretty much everybody involved in it, how's it affected your clients in particular?
Interestingly enough, there's definitely two distinct camps.
Okay.
There's those people who have been not necessarily drinking more, but drinking earlier, because maybe they don't need, well, they're working from home.
Yeah.
They don't need to think about having to pick the kids up from school. They haven't got to think about driving the car the next morning. So there's that distinct group who, in all honesty, I think if somebody was bordering on having a problem, I think all the pandemic has really done is it's brought it forward.
Okay, yeah.
So, you know, maybe 5, 6, 7 years down the line, they would have realized that they were over drinking, whereas now it's just made it earlier. But having said that, there's also a very distinct camp of people who are actually found lockdown has been fantastic for them. So people with social anxiety who were drinking because, you know, socially anxious, people with agoraphobia who were drinking to medicate, all of these ADHD to a certain extent. You know, so a lot of people assume the pandemic has been a really bad thing, and it has for a lot of people, but there are a lot of people who are now dreading the reopening. Absolutely. Definitely more people have found the Sinclair method, which can only be a good thing.
Totally.
Pretty much because, like I said earlier, the people have had time to Google, you know, and that's a good thing. But yeah, when the pandemic and the lockdown started, I was like, oh gosh, we're going to get inundated. And as it went on, we have, and we I think in January we started 49 new people onto this treatment, and that was just January alone. So yeah, absolutely, we've been, more people are finding us, but these are people who either in a lot of cases had a problem, or like I say, it's been brought forward a bit.
So in some kind of weird abstract way, it might have actually helped them or benefited them in some way to have gone through this pain now, so that they're now in a space where they can tackle it now.
And in many cases, these, you know, there's very few people who have to medically stop drinking. You know, a lot of people are just over drinking too much and they just need help to bring it back. They
Yeah.
don't need to be labeled as being
Totally.
an alcoholic or you know, they're not on street corners, they're not losing the job, they're not losing the home, they're just literally drinking too much for comfort, and they've tried to reduce on their own and they're struggling. And that's where the Sinclair method really comes into its own, because these people 6 to 8 months from now, they've no longer got the issue as such.
Yeah.
So why should they be labeled on their medical records for the rest of their life as being somebody who had a drink problem?
Yeah.
You know?
And they've got all those new skills that you would have helped them adapt to as well throughout their treatment.
You know, dealing with work stress, dealing with family stress. I think that we've definitely seen an increase in women coming to us, and a lot of them cite the having homeschooling situation, which you know you can really understand.
Yeah, totally.
To a certain extent. But the general stress, people aren't used to having to spend all that time. You know, even families who love each other a lot, they're not used to having 2 people at home working from home, kids at home, pets at home. You know, it like their world squashed down into a little box, and a lot of people have found it very difficult to deal with.
Yeah, so I mean, I see with my own partner that it's just that as we're starting to come out of it all now, I've just noticed the last couple of months she's starting to look quite tired all the time. And I'm just thinking, like, I just said to her, like, you know, you need a week away just on your own. No me, no cats, just be on your own, do some writing, whatever you want to do, but just go somewhere by the sea or something, you know.
Can't beat the sea. You really
Yeah.
can't. I live on the coast, so I know that. It's the beauty of being able to get some fresh air and walk and just downtime.
I think so.
Absolutely amazing.
Yeah, I used to live along the south coast, and I do miss the coast because now I live in the middle of the northeast now. But yeah, it's just like that ability that I used to have of just walking down to the seafront and just you know, walking for 2 miles or so and just have uninterrupted seaside. It was nice.
Yeah. Absolutely. And I mean, I'll give a little shout out as well. We there is a lot of misconception around drinking, and you know, people from all walks of life, you know, the LGBT community, absolutely, most people, shall we say my age, 50, if you're in that community, a lot of your social life revolved around pubs, bars, clubs. That's the way it was back then. And we deal with so many people from that particular section of the community who also, it's not that they've got any issues in their lives, because, you know, they've gone through the toughest stuff. It's just that their brain got accustomed to drinking. And then when you remove that, it misses the chemical reaction.
And they just kind of sat there twiddling their thumbs thinking, well, what do I do instead? You know, how can I fill this time in my life?
This is it's similar. I like to liken it to it's that a feeling you get when you're a child and you drink soft drinks, and then you move on to coffee and tea. And then at some point you go, oh, my brain prefers coffee in my case. And then you drink more coffee and more coffee. And then you get to the point where the next morning you can't even start work until you've had a coffee. In a way, it's a very similar learning mechanism.
Totally.
If somebody totally removed coffee out of my life just like that, I'd be like, wow, I can't do this. I'd be a mess.
I think it's exactly the same, actually, because I mean, with caffeine withdrawal is a very real thing that can actually be quite debilitating. You know, it can give headaches, it can make you feel nauseous, it can affect your mood if you don't have it. So totally. I think it's a very apt.
Whereas if somebody said to me, what we're going to do is over a period of months, we're going to gradually reduce your coffee intake to get it under control. And then when it's under control, you can make a comfortable decision as whether you want to carry on drinking coffee. That's a different ballgame. This is such a humane treatment.
Exactly.
Because we're not pulling the rug from under somebody's feet and saying, right now, you've got to cope with life.
You
know, we're doing it slowly and gradually. And more importantly, it's lasting. You know, it's a permanent change in the brain to extinguish these pathways.
And I think that, again, going back to the holistic nature of the treatment and talking about the LGBT community, that if one of the things they've struggled with is having to try and extinguish behaviors that other people don't like, which is something they've often had to do, this kind of Sinclair method is more adaptable to their lifestyle, and
Yes.
you're not asking them to really change their self, which is obviously something they're going to be very sensitive
Yeah.
about.
Absolutely. There's only one absolutely non-negotiable compliant to the Sinclair method, and that's the compliance, the protocol.
Yeah.
You know, you do have to continue to take a tablet an hour or 2 hours before drinking.
Yeah.
That is the only bit. Everything else, what we do especially, everything else is suited to the individual. So when you get to find out how the individual's life is,
yeah,
how their drinking is, how their work is, how they're, you know, what pressures they've got, when they've got those pressures. And again, from a woman's perspective, hormone changes, huge drivers of drinking. Totally. So once you get to find out these things, you can adapt the Sinclair method to it to get the best benefit from it in the shortest time possible.
Yeah.
And that's really what anybody wants, is to get better.
Yeah. Nobody wants to be ill.
Yeah, exactly. Nobody wants to feel this slave, like, you know, I've got to have a drink before I can deal with this situation.
Yeah.
You know, nobody, but when you're trying to find the way out is difficult.
Yeah.
And that's what the Sinclair method is so wonderful. Now the word is getting out about it a lot more.
Yeah.
Now we're publicizing it the best we can.
Yeah.
Talking to people, doing podcasts like this.
Yeah.
You know, these are all the things that eventually are going to help more people find it and get well.
Yeah. Yeah. Yeah.
After.
And it'll eventually become impossible for the NHS to say no to it.
Hopefully, yeah. Hopefully.
Yeah. You know, some of the stuff that is on the NHS, like sometimes I find it quite surprising because of the lack of evidence behind it that it works, basically. And that can come in any way, you know. I'm not just talking about Reiki or anything like that, but any treatment. And a lot of it does have a place in the NHS, but then not to have something like the Sinclair method is making me think, how many other things are out there for other illnesses?
Yeah. Yeah, I mean, a big one going forward is things like medical cannabis. You know, sooner or later, that type of thing has to change.
Yeah.
And way back when, you know, somebody who smoked was ostracized.
Yeah.
Now, if you go to your doctor and say, you know what, I want to stop smoking, you know, you get the red carpet laid out for you.
Yeah.
You get the medication. You get a meeting every couple of weeks with a nurse at the surgery to see how you're doing.
Yeah.
You know, I think very often for the NHS, it's almost like, where is the focus?
Yeah.
You know, once upon a time, the focus was on depression. Now it's been on smoking.
Yeah.
So sooner or later, I think it will come to the point where the money involved in terms of social and economic expense through drinking, it's going to force a change.
Yeah.
It's got to force a change sooner or later, because you know, it's just not sustainable.
Yeah, totally. Yeah, completely agree.
Hopefully it will. Whether it'll be in our lifetime is a different
matter. That's the other question.
You know, but it's wherever the money it goes, you know, wherever the budget is going to try and help, you know, it needs to be spent wisely. And unfortunately, throwing money at something without taking into account things like the Sinclair method is probably not spending it wisely.
Yeah, exactly.
The NHS detoxing people to have them go out and drink again a week later, it's just not.
No, it's not sustainable in any way.
No, it's not. But there you go.
But well, yeah, I think that pretty much covers everything that I wanted to go over today. Is there anything that you want to say at the end, or anything that you want to cover that we haven't covered?
Do you know, I think the most important thing I would say to somebody who's watching this is just don't give up hope.
Yeah.
That even if it's not the Sinclair method, there is definitely a way for somebody to get better out there. It's just finding what works for that person. Keep digging. A lot of these things, such as the Sinclair method, it's not expensive. It really isn't. I mean, let's face it, nalmefene on it in itself is a generic medication. You know, I mean, it's cheap. But you've got to find what works for you. And when you find what works for you, follow it through. Don't keep having people saying, no, we don't do it. Follow it through. Follow it through. Get help. Go onto Facebook and ask people, has anybody done this? You will find somebody who has. Yeah. And they can point you in the right direction, maybe of a doctor you need or support you need. It's out there. It's just unfortunately so difficult to find.
It's just accessing it and finding it, that it exists in the first place, is the challenge, isn't it? And
so most definitely do not give up hope. Whether your issue is drinking or drugs or sex or gambling, whatever it is, do not give up hope, because if you give up hope, you're going to miss out on what is actually there. You've got to keep searching. You've got to keep looking.
Yeah. And well, yeah, I guess just thank you for all the hard work that you and your organization are doing.
Thank you for having me on. It's been great, actually. I've enjoyed it.
Yeah, I've had a really good time talking. Thank you.